I'm going to go ahead and share my screen. So please give me just 1 minute. All right. So again, welcome to everyone. We really appreciate you being here with us for today with Upside. We are going to be talking about an introduction to mindfulness for today. For those of you who do not know me, I will give just a pretty brief introduction to myself in case anybody is new here. My name is Dr. Michael Arevalo, and I am a consultant with Upside Health. Again, really excited to be here with you all to present on another helpful tool in managing chronic pain, which is mindfulness. We're going to talk a lot more about it as we move forward. So just a little bit about me. I am a clinical psychologist, and I do specialize in working with people with chronic pain as well as overall health psychology. For those of you who may not be familiar, health psychology is a branch within the field of psychology that focuses on how biological, psychological, and social factors all impact chronic health conditions, including chronic pain. As I mentioned previously, I do reside in the West Coast. I live in Southern California, so it is morning for me. Good afternoon for those of you on the East Coast or other parts of the country. And I do practice as a pain psychologist here in Southern California. So our session overview for today, we're going to start off pretty briefly in reviewing the four systems of responding. Dr. Sorrell talked about this previously. I think it's really helpful for a lot of people who are new to our platform here at Upside and with Branch. I definitely want to go over and cover it briefly. And I do mean briefly because we have a lot to discuss today about mindfulness. So we're going to talk about what mindfulness is, a little bit about mindfulness research and the efficacy of mindfulness, and then we'll be having kind of a touch point and takeaway. So the four systems of responding. So for those of you who are new, and this is new for you, the four systems of responding is how we respond in multiple ways to our pain. And there's a dual relationship between these specific areas because they can also affect our pain. There is a physical system. That's the first system to respond when people first have pain. And it can include your respiratory system, your blood flow, your heart rate, all of your body's physical responses as a result of pain. We also have an emotional system. So there are often a variety of emotions that come along with experiencing chronic pain. It could be fear, anxiety, hopelessness, depression. There's also our cognitive system. It's the thoughts that we have as related to pain, our expectations, our hopes, beliefs about pain, even our mindset and how we approach situations can be related to pain. And we also have a behavioral system. So it is what we often do as a result of chronic pain. Behaviors that can often happen can be avoidance, escape, hesitance, and we want to eventually work on shifting to engagement, approach, and connection. So it's really, really important that people understand that there's a dynamic interaction between all of these systems, and they can influence or affect each other. Again, that dual relationship. Essentially, pain can affect all of these areas, and these areas can all affect pain. How you think, how you feel, how you behave, your physical reactions can all be influenced by pain, and then vice versa. So your thoughts, your feelings, behaviors, and physical reactions to pain can also affect your pain as well. These are things that can turn up the volume to pain. So let's talk about the helpful skill for today. Let's talk about mindfulness. It is one of those things that can essentially help to turn down the volume for pain. Where I'm going to start off here is, if I may, I'm going to start off with a very personal story. A lot of times some people can have a negative bias towards mindfulness and meditation, and it can be coming from a place of not really understanding what that practice is or what it's about. To be honest, this is a self-disclosure for me. I used to be one of those people. I used to have a pretty negative bias with mindfulness. I didn't think it was for me. I didn't think it worked. I didn't think it was something that I could practice. I respected it as a practice for people who did practice mindfulness and meditation, but I just didn't think it was for me. And it wasn't until I really discovered that I was practicing it in my daily life, unbeknownst to me. It really wasn't until I discovered it that I started looking more into it. And what happened was about 6 years ago, one day I was running late from work, and I was running out of my apartment, and I bursted out of my front door, and I was literally blinded by the light. You see, what had happened is the day prior, it was raining. And the morning of, it had stopped raining and there were puddles all over the parking lot. And so when I came out of my apartment, the sun was shining directly into a puddle that reflected directly into my eyes as I opened the door. And I stepped off to the side, I rubbed my eyes, trying to reorient myself. And I looked up and looked around, and everything was beautiful. Everything looked clear. I heard the birds chirping. There was a soft breeze. And so I'm proceeding to walk to my car, and I'm just looking around me, paying attention to everything like, wow, I had no idea that there were even birds out. And if people, when you see a sunny day, the day after the rain, it's really beautiful. The air feels so crisp. And I had this sense of calm and peace come over me. I get into my car and I think to myself, is this mindfulness? Is this what people keep talking about? What I hear people explaining about? And then I look at the clock and I see, oh goodness, I'm late for work. And I instantly got anxious. I started my car and I head over to work. And it was that moment that I realized, okay, maybe there might be something here with mindfulness. Maybe there's something here, but in order for me to see what it is exactly, I want to understand what it is. I want to understand the origins of it, and I want to look at the research of it. Because as a psychologist, I want to be able to see, is there science backing up the efficacy of this? And so that's essentially what I'm going to give to you all today, very briefly. Is I'm going to give to you what it is, the origins of it, and the research behind it, in case that this is something that you may not have thought of as a practice that can be helpful for your pain, because it can be very helpful for pain. There are two things to think about when it comes down to mindfulness: time and consistency. It takes time for things to get a little bit easier, and it takes consistent practice, daily to almost daily practice. And I'll explain more about that shortly. The type of treatment that I gravitated towards most in understanding mindfulness is an evidence-based practice called mindfulness-based stress reduction, MBSR. For those of you who are interested in learning more about this, again, it's mindfulness-based stress reduction, MBSR. And it was created by a man named Jon Kabat-Zinn. So Jon Kabat-Zinn didn't create mindfulness. He just created a standardized protocol in understanding the practice of mindfulness. So mindfulness is the umbrella term. And within that umbrella, underneath that umbrella, is meditation. Meditation is a mindfulness practice, but there can be a lot of other types of activities that people can do that can be considered a mindfulness practice. So again, mindfulness is the umbrella, meditation is under that umbrella, and there's a lot of other practices that can be within that. So what is mindfulness? The first definition on here that you see on the PowerPoint slide is by Jon Kabat-Zinn himself. Again, the founder of mindfulness-based stress reduction, MBSR. So Jon Kabat-Zinn defines mindfulness as paying attention to something in a particular way, on purpose, in the present moment, non-judgmentally. There's a group of researchers, Scott Bishop and his colleagues, a group of psychologists and mindfulness researchers, and they proposed a two-component model of mindfulness. The first component involves the self-regulation of attention so that is maintained on the immediate experience. And the second component involves adopting a particular orientation towards one's own experience in the present moment, an orientation that is characterized by curiosity, openness, and acceptance. Now, these are textbook definitions from mindfulness researchers and creators, but they can be a little bit too wordy. So here are two definitions that I've adopted for me myself in understanding what mindfulness is. And maybe this can help you as well if we kind of break through all the jargon and kind of simplify it a little bit. So here is the bare bones definition of mindfulness. It is being actively engaged in the present moment without judgment. And we as people, we can be engaged in the present moment. We can do our best to kind of stay focused on something, but it's really hard to not be judgmental. I'll give you an example. Let's say it's a dark, cloudy day. It looks like it's about to rain. I'm looking outside and I'm paying attention to the dark clouds, and I'm paying attention to, I see the wind blowing all the trees. Now, I may gravitate towards the judgmental because toward judgment because I may start thinking to myself, it looks cold out, it's gonna rain, I didn't bring my umbrella, what I do want to go outside, right? So I'm not fitting in that definition. I'm already being so quick to judgment, to judging things because we all have an opinion about everything. Another bare bones definition of mindfulness, which may be a little bit easier to remember, is non-judgmental moment to moment awareness. Mindfulness does require consistent practice. It's like a muscle. It's a muscle that needs to be strengthened, just like a skill like any other. Again, time and consistency to reap the benefits of mindfulness. It sounds easy, but it can be very difficult, and again, takes time and consistency. So let's talk about the origins of mindfulness. So all religions have branches and often practices that are similar to mindfulness, but its roots, as we teach, lie in the Buddhist tradition. So mindfulness is not a religion. Sometimes people might think that mindfulness is a religion. It's not a religion, it's a practice. And it can be a very helpful practice, and its origins does lie in the Buddhist tradition. Mindfulness, as taught by mindfulness-based stress reduction, or pretty much a lot of other mindfulness-based treatment, it stems from the tradition of Vipassana, or insight meditation. So there are three main strands of Buddhism. There's Zen, Tibetan Buddhism, and Vipassana. And Vipassana is based on the larger teachings of Buddhism. It stems from Southeast Asian countries like Thailand, Burma, Sri Lanka, and it translates into clear seeing or insight. The focus is to gain a deep transformative insight or wisdom into seeing things as they are, which will lead to freedom from suffering. Because oftentimes, we as people, it's very hard for us to see things as they are. We see things as we are and our own internal states. So Vipassana made its way to the West in the early 1960s from Westerners who traveled to Asian nations to learn from other cultures, and they ultimately studied, practiced Buddhism, and brought it back to the West. So very brief introduction to mindfulness and its origins. If you're interested in learning more, again, mindfulness-based stress reduction, in my opinion, does a really good job in talking more about the roots and the origins. There can be, unfortunately, a lot of possible consequences if we're lacking awareness in the present moment. This is where mindfulness comes in to be helpful for people. If we're not aware of our mood, if we're not aware of our present moment, we're not going to be aware about how our mood colors our objective experience. So here's an example. If I'm upset, angry, irritated, I'm going to see things from that lens, right? I'm going to see things as I am, not as they are. I'm more likely to pay attention to more things that are going to cause me to be more upset, angry, and irritated. Or if somebody says something to me, a friend, family, loved one says something to me, I may interpret that as in a negative way because of my own internal states. Also, another consequence of lacking awareness in the present moment is oftentimes we carry a lot of tension and stress in the body without realizing it. And the thing with body tension is that is one of those things that can increase pain. It's one of those things that could turn the volume up to pain if we consistently have that body tension. And sometimes we might not know at the end of the day, it's like, why do my shoulders hurt more? Why does my back hurt a little bit more? I don't know why. A possibility is that maybe you were tensing your back, your neck, your shoulders, your muscles throughout the day due to stress, due to something else that was happening on in your life. And that's causing more pain later. So here is a really quick intervention and strategy for you all, if you so choose that it might be helpful for you. Please take a moment now if you want to pull out your smartphone, smart device, or a Post-it note. And I want to ask everyone to write down or make a note to, at 2 p.m. tomorrow, what is your muscle tension? So on your phone, you can put a reminder, 2 p.m., check muscle tension, or write on a Post-it note, 2 p.m. tomorrow, what's my muscle tension? What I want you to do at that time, 2 p.m. tomorrow, is check your muscle tension. Are your shoulders up here, right? Is your back tense? Are your fists clenched? Is your jaw, are you clenching your teeth? Because these are things that we don't notice unless we become more in tune or mindful of our body and where we are in the space around us. Another consequence of possibly not being aware in the present moment is sometimes you can miss out on a lot of positive and pleasant moments in our life. Or we can hold on to difficult moments or experiences in our mind. So let's talk about mindfulness research, right? I want to be able for people to see the efficacy of this and know the science behind it because it does work and it could be very helpful with time and consistency, time and consistent practice. I'm going to split this up into three sections. We're going to talk about how mindfulness is effective for symptom reduction, how mindfulness has an impact on our biology, and how mindfulness has the ability to literally change the brain and rewire the brain. The research is there, it supports it, it's helpful. So there are a lot of words on this slide. I am going to talk pretty briefly and generally just for the sake of time for today, but essentially these are just 3 bullet points of a couple of research articles that demonstrate the efficacy of mindfulness in helping to decrease symptoms. What these researchers and psychologists did is they implemented a mindfulness-based intervention to see if it can help with depression, anxiety, and chronic pain. And they found that it can be very helpful in decreasing depression, anxiety, chronic pain, and other chronic health-related conditions. And the key, what's interesting is that in the first bullet point here, Hoffman Sawyer and his colleagues found mindfulness interventions had a moderate impact in improving anxiety and depressive symptoms, and the results were maintained over time. So in mindfulness research, there are biological markers. Dr. Sorrell has talked about this. We also had a couple of articles on our platform regarding cortisol. For those of you who are not familiar, cortisol is also referred to as the stress hormone. When we become very stressed out, our body starts producing cortisol, and cortisol can be pretty inflammatory, and it also starts our fight or flight response. Maybe some people are familiar with the fight or flight response. It's our body's reaction to an external or internal threat. And see, what happens is cortisol is a good biological marker in understanding that we are actively stressed out. And you can detect cortisol in your saliva. And so there's a couple of researchers who wanted to see the effectiveness of mindfulness if it can actually decrease a biological marker, cortisol, in people's bodies. So where can we go to find the most stressed out people? Colleges and universities, because during finals times at colleges and universities, students are more so very stressed out. So what a couple of researchers did is they had gathered 20 participants, 20 students around finals time, and they tested their saliva to look at the cortisol, the amount of cortisol, to see how stressful they are. They separated these 20 people into 2 groups. 10 people went into a room and they were exposed to a mindfulness-based meditation. So they meditated for about 20 minutes and did different practices of meditation for 20 minutes. Another set of 10 people went into a room and they didn't do anything. They didn't administer any kind of treatment. They just told them, just hang out in the room, study for your finals, whatever you feel is best for you. And then they tested their saliva afterwards. Well, the amount of cortisol in the group that experienced the mindfulness intervention had less cortisol in their saliva than the other group. And what's really, really interesting is the next day they tested the same people, and the people who did the mindfulness intervention still had less cortisol in their saliva than the other group. This is just one example and one study, and there's so many more supports in showing how effective mindfulness can be on our biology. And lastly, in mindfulness research, it literally has the ability to change your brain. So there are a lot of MRI studies, SPECT scan studies, EEG studies that show that that mindfulness practice has the ability to change your brain structure as well as your functioning. For those of you who may not be familiar with the SPECT study, SPECT scan studies are single photon emission computerized tomography test. It essentially lets your doctor analyze the function of some of your internal organs, specifically the brain, to take a look at it. You see, the act of bringing your attention back to the present moment helps you grow connections in your brain, right? Cells that fire together, wire together. That's a saying in neurology, which means that, the more active your neurons are in your brain, it's essentially creating new tracks in the brain. It's like working out your brain. And mindfulness is like a muscle. The active effort of bringing your attention back to the present moment is like working that muscle. An example I'll use is going to the gym. If somebody wanted to grow their biceps, then maybe they might do dumbbell curls. And you lift the weight up, you contract, and you bring the weights down. You release, lift the weights up, lift the weights down, right? And then over time, you'll grow your biceps, you'll grow your muscle. you see, mindfulness is the same way. Bringing your attention back to the moment is like doing a rep, right? It's like doing a bicep curl. Your mind is wandering, bring it back to the present moment. You just did another rep. That is helping you to build those places in your brain to create more neuronal connections. You want more neurons to be firing within your brain. In the last bullet point here, a researcher and psychologist named Dr. Lazar, along with his colleagues, they were one of the first people who conducted a study to explore the brain changes in people who meditate. And they found the following: experienced meditators had cortical thickening in areas related to emotional, sensory, and cognitive processing when compared to non-meditators. And what cortical thickening means is that more neurons are interconnected and firing, so they can feel more and process more in their brains. So in mindfulness-based stress reduction, again, MBSR, Dr. John Kabat-Zinn talks about the attitudinal foundations of mindfulness. What he speaks about is that he believes that all of these attitudes are the foundations that make up mindfulness. And he talks extensively about them because this is just an introduction to mindfulness point, a session, branch out session. I won't go too deep into it, but he does talk about it can be very helpful in the overall practice of mindfulness to develop a sense of curiosity, kindness, gratitude, and generosity, acceptance, to be non-judging, to be non-striving. What non-striving means is always wanting more, right? There's a book called The Happiness Trap. And in the book called The Happiness Trap is that how sometimes this striving for more can lead to a lot of increased suffering. Letting go or letting be, patience, humor, trust, any beginner's mind. A beginner's mind is looking at the world from a sense of curiosity and kindness. So a couple final points here. Again, it's just an introduction to mindfulness piece. The key takeaway is that mindfulness is a scientifically proven practice that can help decrease pain. And mindfulness does take time and consistent practice. It requires daily to near daily meditations. That's always recommended. And it doesn't have to be anything extensive, right? We can build up to things. We can't go into a 20-minute meditation. We can't go into a 15-minute meditation. There are a lot of apps. There are a lot of YouTube videos that allow for 3-minute meditations, 5-minute meditations to bring yourself back to the present moment. If this is something that you've practiced before and it is something that you struggled with, that's okay. Everyone struggles with mindfulness. It takes time and consistency and practice to get better at it. For a lot of people, especially with my work with people with chronic pain, it's, well, if I'm in an immense amount of pain, how do I not focus on my pain? Well, we can focus on externals. We can focus on what's around me and train that brain to look outside of the pain if possible. Time, consistency, right? I'm not saying do it for an extended period of time. It just takes a little bit of time to start getting into the practice of it. 2 minutes, 3 minutes in being non-judgmental and having that non-judgmental moment to moment awareness. I'm going to come back to you all here because I am aware of time. We have about 5